Okay, Chad, go ahead.
Okay, so we're the group. We are for the U.S. I think we're group 7. Um, we're the U.S. Department of Health and Human Services. And then next, sorry. So what is the HHS is also like what it's known as, like the initials of what it stands for. So it's also known as the Health Department. It's a cabinet level department of the U.S. federal government. So like we learned in our lesson, it's part of the public health sector. So their mission statement here is to enhance the health and well-being of Americans by providing for effective health and human services and fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. So that's a mouthful, but pretty much they, look out for all Americans, whatever your race, gender, um, classes. They try and meet the needs of all the Americans regarding any health, medicine, or social services. Next. So just a little history about it, because a lot of things have happened within the department, and I just thought it was super interesting. So in 1930, the National Institute of Health was created, and then in 1946, the Communicable Disease Center was established. Um, I'll just kind of read through some of these. So it was until 1965 that Medicare and Medicaid programs were created. Um, when, let's see, something interesting also that I didn't know in 1981 or 19, oh, I'm sorry, it says 1984, was when the HIV virus was identified by the Public Health Service and French scientists. And then it wasn't until 1990 that Nutrition Labeling and the Education Act was passed and authorized the food label. 1993 was when vaccines for the children's program was established, providing free vaccinations and stuff like that to all children of low income. 1996, the Health Insurance Portability and Accountability Act was enacted. And then just things like in 2001, the Centers for Medicare and Medicaid was created, and that's what replaced the Healthcare Financing Administration. And then just recently, as we know, the Affordable Care Act was signed in law, and so that was this is a department that oversees that as well. Next. And then just some other interesting facts that I found is their budget accounts for almost 1 out of every 4 federal dollars, and then it administers more grant dollars than all of the other federal agencies combined. And then the Medicare and Medicaid together provide health insurance for 25% of Americans. And just in the HHS, there's about 80,000 employees. And then they have spent about 67.4 billion so far this decade. Next. So in organization chart, the head is like the secretary, and then the deputy secretary, and then the chief of staff. And so they kind of overlook these departments. And then I think the ones that we're most familiar with and that we've heard of and is most well known is the ones in the bottom there, the Office of Secretary and then the operating divisions. So they're broken down. So if you go to the next slide, these are just kind of ones that, there's a lot of them. There was just a lot of information, so I just kind of listed some on there. But like in the Office of Secretary, within that office, there's like the Office for Civil Rights, Global Affairs, Medicare Hearings and Appeals, and then in the operating divisions, I think it's the one I'm more familiar with, which is the Centers for Disease Control and Prevention, the CMS, the Food and Drug Administration, and then the NIH. Next. And then this is part of his slide that he's presenting. So, and then, there you go. Oh, can you go to so they're just the principal roles as in that picture there. They have their mission and vision, which is just super helpful, but pretty much they manage a wide array of health and welfare programs. They're responsible for regulating food products and new pharmaceutical drugs. They implement the nation's biggest healthcare programs, prevent outbreak of spreading diseases, and then they just do like medical research and they fund that in the world. So next. And so, oh, I'm sorry, the slide must have not shown, but these are just kind of like sections that are broken down into. So there's HIPAA, health insurance, social services, prevention and wellness, providers and facilities, public health and safety, and just things like that. Next. And then, so some programs and services offered is HIPAA. So I actually work at the support center as a manager here at BYU Idaho, and we handle a lot of the health insurance calls. And so this is something that I'm more familiar with. It's just like a privacy rule, they call it, but it's just to make sure you know to just be careful of what information you give out, especially with the health insurance and who you're treating and things like that. And then they have health insurance programs such as the Affordable Care Act that we know, Medicare, Medicaid, and then the Children's Health Insurance Program. Other things that we're familiar with is the Temporary Assistance for Needy Families, and then the Supplemental Nutrition Assistance Program, Head Start, and then they provide vaccinations and immunizations. Next. And so I just thought this was really interesting. Just to kind of see how they implement programs. So this is for the Head Start program. So they have, you know, a management system. They want to ensure that their programs meet the high quality standards that foster the staff, the child, the family, and the community. And then services to implement that is, you know, to just provide the children with their services, develop strong relationships with the parents and children, and then link the children and families to community services. And then so it leads to outcomes which will enhance children's growth and development, enhance parent and child relationships, and strengthen families. And then their final goal is the children's well-being and confidence. And that's it.
All right. Good job. Cool. I think in this case, we're going to go ahead and forego any questions. Very well done. For those of you who are watching this, we had to just split up Chao's and Andrew's presentation. So there will be a separate link for his part there that we scrolled through with all the pictures and everything. So be sure to watch that as well. And that's about it. So thank you, Chao.
All right. Thank you.
Yeah, have a great rest of the evening.
You too.
We'll see you later.